So I know English, I know nursing.
Yeah.
Still, why I'm struggling in OSCE?
It's not about you know about English, but it's just at how you should speak it. See, the name itself is saying therapeutic communication. So what does therapy means? It's a healing process, 5-finger rules. And this could be applied by any person.
Okay.
If you want to attend my class or if you don't want to attend my class, you can directly approach the OSCE examinations. I think you can definitely do a high level performance.
Hello everyone, this video is especially for the nurses who are preparing for the New Zealand OSCE, whether you are attempting it for the first time or you are resitting for the exam. By now, it's very clear that the biggest challenge our nurses face in New Zealand OSCE is communication. Most of our nurses are having really good theoretical knowledge and they are strong in the clinical skills as well. But somehow when they come for OSCE, even for the preparation, they find it very challenging to express themselves confidently and naturally. And this lack of confidence is one of the main reasons for not so optimal performance in the OSCE exams. So we have been seeing it for a while, and that's when we decided to do something about it. So that's why we decided to develop a course dedicated to the communication aspect of OSCE that we call it Therapeutic Communication. We developed it with a British Council certified language trainer. His name is Roshan. So Roshan is with us today and he will tell us exactly what the program is and what difference it can make in your OSCE preparation and an exam. So Roshan, welcome.
Hello.
Thank you for joining us and let's talk about our therapeutic communication program. So our first question is the most common question. So I know English, I know nursing.
Yeah.
Still, why I'm struggling in OSCE?
Okay. There are various reasons that you struggle in OSCE, right? It's not about you know about English, but it's just at how you should speak it, right? There are different techniques of speaking. Cultural differences are there. Like when we take the Indian context, when we ask the name, the general question is, what is your name? And we accept it, correct? But when we go to the other culture, we have to be polite. That may I know your name, right?
Yeah.
How do you prefer calling you? Like how may I address you? All these are the professional and the best ways to discuss with a person. So you have to be extra polite. So this is one reason. So when they go over there, when they ask certain questions, the actors over there or the patients who are there in New Zealand, they might feel this is something rude, and they might react accordingly. And when they give a negative reaction, this is when the panicking starts. This is one reason. So we are having a cultural shock.
Okay.
The other reason is lack of confidence.
All right.
Right? Someone is observing me.
Okay.
Right? We have an assessment team over there, and we have this, understanding that this particular station is being acted by a person. So he is an actor, and you have in your mind that you are not a good actor. Right? I'm just a nurse. You have that in your mind. I'm just a nurse. How can I act? So you go with that preset mind that I will not be able to act. You just have to act normal. You have to be normal, just like that's another patient over there. So when you feel that normalcy, you have that situation that's very normal, that is when you get, you gain confidence. And then when you have this understanding to be polite, I would say extra polite, that is when you will understand that you can definitely communicate with any person, irrespective whether it is a patient or your subordinate or your superior, any person. Be extra polite and you can definitely do it.
All right. So one more thing. So how different is it from a regular spoken English course? I'm talking about the therapeutic communication aspect of it. So what difference is there?
Oh, it's a vast difference is there. See, the name itself is saying therapeutic communication. So what does therapy means? It's a healing process.
All right.
So your words will also help in healing.
Okay.
Right? Spoken English is the general way of speaking a language. The spoken techniques,
Sure.
how to speak certain, how to frame sentences, right? What are the prepositions? What's the adjective? What's the, pronouns, subject, verb, agreements? All these things we are teaching while we are making them learn the spoken English. It's general. It's a basic grammar. But when you're coming to therapeutic communication, we are, getting much deeper. What you should do, how you have to calm down a nervous patient, right? How to as an anxious patient, exactly. How to understand the scenario that he might say, I'm feeling nervous.
Yeah.
So you cannot jump into a conclusion. You have to find out why is he feeling nervous, correct? And then once you have a detailed understanding of the situation, that is when you will give him suggestions or recommendations where he will start understanding the situation, and he's getting this feeling in his mind that there is someone who is listening to me, not hearing, listening to me, because this is something very important, active listening.
Okay.
So someone's listening to me, and when somebody's listening, you start discussing. The moment you start discussing, the anxiety level comes down,
Okay.
right? And when the person is now calm and cool, then we can help him out in making solutions, we can give him suggestions, and he would feel much better.
Okay.
So this is how we teach therapeutic communication.
Okay.
How you have to communicate with patients,
Okay.
right? So that is how different is spoken English when compared to therapeutic communication.
All right. Can you just walk us through the program? So what our nurses can expect once they join, or can you just give a few examples? What or scenarios you'll be discussing there?
Okay, so primarily when you take the OSCE scenario, you have like 10 stations, right? Of those 10 stations, I would say 3 stations are specifically focusing on the nursing skills. Rest of the other stations are having detailed communications where you have to attend a patient, you have to explain certain things. So whichever station you go from station 1 to 10, if there is communication involved, I would say that in this particular program that we have designed for the nurses for OSCE, we would be making them understand how to deal in each station,
Okay.
right? There are stations which are much similar, but there would be differences also. So we will pinpoint what are the difference and what are the similarities, how they need to attend each station and each patient differently. What, like, the patient could be cooperative at times, the patient may not be cooperative at times.
Okay.
So we give them different scenarios. So if he is cooperative, how to attend it.
All right.
If he is not cooperative, what should you do,
Okay.
right? So generally what happens when you're going to the OSCE exam and you find an actor over there, you might imagine that you would ask a question and he would reply the exact way that you want, right?
Yeah.
Imagine what if doesn't have, if it doesn't go that way.
Okay.
Now you would panic.
All right.
What should I do? So to avoid that panic, we give you the tricks, we give you the techniques, how to, in case if you feel panicky, if they want to trap you by asking certain questions, how you should not fall into that trap. Even if you fall, how you should come back. All these techniques we are giving them. So this is our 5-day, 10-day program where we are specifically focusing on the nurses. We are giving them the therapeutic techniques, how you have to attend the patient, how you should take the suggestions, how you have to give him, better care and all. Like there are care plans are there, right? Then we are attending all these queries from whenever he's feeling anxious. Why should you do this? Why should you do this? We have to give him the answers in a respectful way. Correct? The nurse is a person who cannot decide, but rather she can assist. She's a caring person, right? The decisions are generally made by the doctors. But what the people, when they're doing the OSCE, what they do is they jump into conclusions, they give solutions, and that is where they make something, I would say errors.
Okay.
So we will tell you what are the errors also, what you should not do. So these are something which we would be, supporting the nurses with.
Okay. So you said that the program is for 5 days or 10 days, right?
Yeah.
So basically 1 week or 2 week.
Exactly.
Okay. So what would be a suggestion when they should take? Because we are doing this specifically for those who are planning to write the exam. So should they take before the practical sessions or during the practical sessions or even afterwards?
Well, this could be taken at any time, but it depends upon the person's caliber.
Okay.
Now, you feel like you are good at English, you just need to know the therapeutic techniques,
Okay.
and you are aware of the stations that would be, you would be you have to perform in OSCE. If you're aware about it, then you can take before getting into the practicals. Or sometimes you might feel that I need to know what exactly is happening over there. And once you attend, you would exactly know your pain points.
Okay.
And that is when you realize, okay, where am I lacking? And to improve on those, you can join again. That is another scenario. Or you do all your practicals. Now you have a wonderful exposure to all the 10 stations, correct? And then now you know what all are the problems. And when I come with an assistance with the language part, you can easily understand. So it depends upon the situation. Like one who is a good speaker of the language, he can definitely, take it prior to the practicals. The one who is not can either take it after the practicals or during the practicals also.
Yeah. And most often I get the feedback that after the course, when people take it, they have a better understanding and they could easily connect the dots and
Correct.
they could find the knowledge gap they are having. Yeah. So tell us a bit more about yourself. So how you got into teaching?
Okay, I would say I'm an accidental trainer.
Okay.
I wasn't planning to become a trainer. So I was working in different industries. I was into the recruitment industry. I was into the IT industry. Then I worked in the travel industry. And I would say I also worked for a few time, for a few years in my life. I also spent in the real estate. So I actually had something like I used to connect with a lot of people,
All right.
different people,
Right.
right? And gradually, my father asked me, like, he is, I would say, a scholar in the language of English,
Okay.
right? He is also British Council certified.
All right.
So one day he asked me that, why don't you certify yourself, like, and you can speak well. And I said that I'm not so interested in this. So he forced me, like, okay, even if you're not interested, why don't you write it for fun? Having a certification is always good. So just because of his advice, because he wanted me to do it, I did it. And I got certified also. So I passed it. And when I passed it, that was the time of the pandemic. So one of the kids, like, they asked me, can you help me with this language? So they went, they wanted me to teach the kid.
Okay.
But I was not so interested in teaching. But the moment I started teaching him, he started understanding the concepts well. But those were like basic grammar concepts. And when he understood the concepts well, he scored a very good marks.
All right.
So he jumped the percentage, and that is when I understand that I have this capability inside me, which my father knew, but I didn't realize.
All right.
And gradually, then I started taking up more training sessions. So then I took up personality grooming sessions, right? Then I started, to improve the personality of people. And I started, the spoken English, IELTS training, different kinds of training. And I started to understand that I'm really good at this.
Sure.
I was thinking I was really good at something else.
All right.
But now I realized that I'm a wonderful trainer, that people started, like, accepting me and respecting me. There's a difference in that.
Yeah.
Accepting you as a trainer is something like anybody we can be accepted, right? But respecting will only come if you can give results.
Yeah.
So I started giving results, they started respecting me.
All
So then I knew that I am good at this, then that's how I became a trainer.
All right. So one more thing, many of the viewers will be preparing for the exam in the coming months. So do you have any tips for them, even before joining our course, how to prepare themselves for, or how to get themselves exposed for the OSCE scenarios?
Oh, yeah, sure. I would say I have, 5-finger rule.
All right.
I would say the 5-finger rules. And this could be applied by any person.
Okay.
If you want to attend my class, or if you don't want to attend my class, you can directly approach the OSCE examinations. I think you can definitely do a high level performance.
Okay.
The 5-finger rule: first finger, smile.
Okay.
Smile is very important. There are two aspects of smiling. One, when you smile, the opposite person feels that you are friendly and you're approachable. That is one thing. Smile will also improve your tone, that you have to talk with empathy, right?
Yeah.
So smile is very important. Then you have to acknowledge the query, the problem, whatever the patient addresses. You have to acknowledge that, so that you're showing that you're actively listening.
Okay.
Right? So when you actively listen to the query, the patient gets the feeling that someone is here to listen to my problems. Then he would share more. So to understand the query, please go to rule number 3, which is ask more questions.
Okay.
Right? When you ask more questions, you understand the situation better. Right? It is always recommended to ask questions.
Correct.
And when you get the input, sufficient inputs, then I would say go to number 4, which is give recommendations or suggestions. Do not give solutions. We always have the habit of jumping into conclusions and giving solutions. Do not do that. Recommend, that I recommend, why not do this, why not do that. And once you recommend, take the opinion of the patient. That is rule number 5, wherein you are checking whether he is okay with it or not. Because we do not matter, the patient matter. The patient matters, right? So his opinion has to be given weightage. So his opinion has to be respected. Whether positive, be happy. If negative, let's think of something else. So if you can follow these 5 rules, this 5-finger rule, definitely yes, you can give a high-level performance at the OSCE. This is my suggestion for my viewers.
Yeah, definitely that will help them. And thank you for this session. And
So much.
it's really insightful, and all the best for the coming classes.
Thank you so much.
Sure. And that's a wrap. And I hope you found it informative. And I'm sure it will make a lot of difference in your OSCE preparation as well as OSCE exam, because we have spent a lot of time developing this program. It's very niche specific. It's only for the nurses who are preparing for New Zealand OSCE exam. And it's affordable as well. Even if you take 2 weeks program, it's affordable. Also, I just want to tell you about a offer we are running for resit candidates from anywhere, any agency, because we are sure we can help them with our proven OSCE training program. So we are running a 50% offer on the total fees. So if you know someone who really needs help, just send them our way and we will take good care of them. So if you need more information about the Therapeutic Communication Course, I will leave the academic counselor's number in the comment box or the description. Please contact her. and make sure you attend the program. Thank you.